So my name is Dan Grimes. I have a joint role between an organisation called Merseycare, which is a big community and mental health provider in Liverpool, and the acute hospitals in the city, Liverpool University Hospital. So my role sits in between both those organisations. But my views on transformation are really informed by my kind of professional practice to date, the vast majority of which has been in operational management, largely actually in an acute hospital setting. So my views, I suppose, are going to come from, they're going to be very heavily kind of flavored with that perspective, but I hope it's helpful wherever you are in the kind of health and care system or beyond. And these are really interesting questions because I think they really have prompted me to think about what are the things that I believe in and what are the things that I believe work and don't work. So it's been dead helpful for me to kind of prepare for this session. What it kind of has cemented for me is transformation and change, I think, for me, are indivisible from improvement. So that is the first thing I would say. Transformation is a means, not an end. And so the kind of the transformation in and of itself is only useful if it gets us to a better place, whatever that place might be, in whatever part of the world we're looking at. And I suppose for those people who work and have worked in organizations where there's a really strong continuous improvement focus, and I've been very lucky to work in some organizations like that, transformation then becomes a state of being. It is knitted into the fabric of your culture because you are constantly striving to improve. But for those people who come to transformation from a discontinuous perspective, I still think there's lots in improvement methodology and improvement science that can help inform practices and principles to how we might address transformation. So taking that point about transformation as a means, not an end, I think for me, really kind of basic principles of transformation are it's got to be aims focused. And there are a couple of improvement models, which some of them might be familiar to you. So apologies if I'm teaching this okay. Some of them might not be, but if they're not, I would highly encourage you to look into them a bit further. The first is the Institute for Health Improvement's model for improvement. And it just starts with 3 really simple questions, which is, what are we trying to do? What's the thing we're trying to improve? How will we know that we've done it? So how will we measure our improvement? And not necessarily all quantitatively, but there has to be a sense of we understand when we've got to an improved state. And then the third thing is, what changes can we make then to influence that improvement? And I think those are really fundamental questions for transformation and improvement professionals. What are we trying to do? How will we know whether or not we've done it? And then what are the things that we're going to do to try to get to that new state? And the other bit of kind of improvement theory that I would really encourage you to kind of look at in this regard is the system of profound knowledge, or the lens of profound knowledge, which is again a really fundamental principle of quality improvement. And again, it's really important because it's aims focused. So the system of profound knowledge, it's all about what is the thing that we're trying to do, and I think that's a really critical point for all transformation professionals. And then within that, it encourages you to focus on 4 interconnected areas of focus, and those are: do we understand the system that we're operating in? An understanding of the system only comes from zooming out. So you can only understand a system. You can't understand a system by analysing the component parts. You can only understand a system by understanding the connectivity that sits between the parts of that system. And when I say system here, I'm talking about, this could be as simple as, departments within a hospital, and it could be as broad as, the national health and social care system, but we only understand the systems of it by zooming out. Do we understand how that system performs? And again, this relates to the aims that we're trying. So what are the things that we measure to understand the variability in performance of that system? How are we going to apply kind of a scientific approach to trying to influence improvement? So something that is called a theory of knowledge within the profound knowledge lens, which is designed to get us over our conscious and unconscious biases. It's designed to kind of encourage us to be curious, but in a way that uses tools which are well developed for that purpose, and there are loads of those in improvement science. And then the fourth one, and this is dead important, especially for transformational professionals, I think, is what is the psychology that's at play? Do we understand what's happening for people within this system, and do we understand how people are, why people are behaving the way that they're behaving, and the interactions between people within that system? And behavioral science is an enormous component, I think, of any transformational change, and it's one that we frequently don't have a lot of insight or skills into. That's why OD professionals, I think, are incredibly useful and valuable in that regard, because they bring that knowledge and expertise. But we've got to ask for it. If we're trying to change anything, if we're trying to transform anything, we have to pay attention to what's happening with the people. Otherwise, we're never going to change anything. And this comes back to the Myron's Maxims things, which, you know, I can see in the chat other people big fans of Myron's Maxims, but the two that kind of resonate with me in this regard are real change takes place in real work. So things have not changed unless the work has changed. And so us kidding ourselves that things have changed because we've set up a load of new governance infrastructure or we've gone to a couple of meetings, that isn't change. So real change takes place in real work. And the second is the people who do the work do the change. So the work will only have changed if the people doing it change the way that they work. And that's why I think it's so desperately important that as part of any kind of transformational endeavor, we really take time to understand who are the people and what's driving current behaviors and what are the things that we would need to pay attention to if we wanted to change some of those behaviors towards that end. So the practices, I think, for me, again, they link back to improvement practices. So there's loads of stuff out there that I found helpful over the years. The Breakthrough Series collaboratives, again, the IHI stuff are dead helpful. We did a really, it was really important to me, piece of work at when I worked at Oldham Hospital around improving kindness within the organisation. And we used the Breakthrough Series collaborative approach to do that, just to wrap some method around it, really. And it was incredibly helpful because it allowed us to have conversations in a way that was improvement focused, but it also gave permission to people to kind of call stuff out that wasn't good. And it created a sense of energy around it. And it framed our work so that it wasn't just kind of warm word stuff, which I think is a real danger sometimes. So it gave us some impetus and some momentum to actually change and do some practical things. So I'm a big advocate for Breakthrough Series Collaborative, but there's loads of other stuff, you know, rapid improvement events, clinical microsystems work, whatever. But I would say make sure it's kind of founded in theory, and because it's important, because there are things that work out there. I suppose the last thing, because we were also asked about what might be some of the pitfalls. That's a P word, isn't it, Shane? So what are some of the pitfalls or the pressures and politics that might get in the way of transformation? I think Tanya's already mentioned one about the pressure to perform, and often that can override you know, an improvement approach, because doing something is seen as more important than doing something properly, maybe. And I think that is a real challenge. I also think one of the other real challenges is a tendency to want to oversimplify everything. And I think that is a real pitfall. Now, I've got a book here. I'm going to stop in a second, sorry, but it's called 9.5 Things Disney Would Do Differently If They Ran Your Hospital. And the reason why I like this book is because I used to work for Disney. I was a hotel receptionist at Disneyland Paris while I was at university, and I work in hospitals, so it kind of it ticks two boxes for me. And one of the quotes in it says, "Someone has said, I'm not interested in simplicity on this side of complexity. I'm only interested in simplicity on the other side of complexity." And then there's a really important job for leaders in transformation to try to get to that nirvana of simplicity on the other side of complexity. It says simplicity is the first level of simplicity is born of ignorance, when somebody said, "Oh, that's simple," but they don't really understand what they're talking about. The next phase is paralyzing, because it's complexity where you become overwhelmed. But the third level is simplicity born of profound understanding. And I think it's incumbent on all of us who kind of do transformational change and leadership in that space that's where we need to be able to take our people with us. We need to have a profound understanding of what is the thing that we're trying to change so that we can make it simple for people to follow.